to fill that short poll. So yeah, to start off today's webinar, I would like to introduce myself. My name is Jinu Jose and I am State Project Manager at Plan India for the Birds and Beestock program. More information about the program will be shared by our National Project Manager, Dr. Komal Goswami. Pretty soon. Our theme for today's webinar is hepatitis can't wait. And to put more light into the issue, we have our expert panel who has joined us today. So I'll give a quick introduction of all our expert panels. So we have Srimati Diana Khumanthem. She is IAS DC Imphal East Manipur. Mrs. Diana is the highest ever woman rank holder from Manipur in UPSC Civil Services. She did her schooling from Nirmala Bas High School, Imphal, and topped the Board of Secondary Education Manipur examination in 2007. Post her schooling, Srimati Diana graduated from Miranda House, Delhi University with the BSc honors in physics. After that, she also completed her MSc from the same college. She was a topper in both her graduation and post-graduation. She was a brilliant student throughout her school and college days and has many awards to her name. After her studies, Srimati Diana started a career as a guest speaker in Miranda House. So glad to have you, ma'am. And next in line, we have Dr. Rajni Wadhwa. She is our Director of Program Implementation in Plan India, and she is a public health specialist. She brings expertise in sexual and reproductive health, adolescent health, sanitization and hygiene, STI, HIV, and infectious diseases. Dr. Rajni works as Director Program Implementation at Plan International India chapter and leads different projects on health, communicable and non-communicable disease, water hygiene, and sanitization, among many others across 100 countries. And then next in line, we have Tope Yomcha. He is a District Reproductive Child Health Officer from Namsai District, Arunachal Pradesh. Dr. Yamcha is serving as DRCHO since 2010 under NHM, and before that he was serving as General Duty Medical Officer. He has been working in many districts: West Siang, Changlang, Namsai, and Dibang Valley of Arunachal Pradesh. He started working in less accessible areas, and providing the people there with medical support gives him great satisfaction and motivation to help to improve the health indicator. He has been awarded the title of State Gold Medal for improving immunization status in Changlang district. Then we have Dr. Banikanta. He is a consultant physician and diabetologist. A consultant physician and a diabetologist who has done his MD, DNB fellowship in diabetes from Royal Liverpool Academy, UK. He was also trained in Apollo Hospital, and his special area of interest includes diabetes, hypertension, infectious diseases like COVID-19, typhoid fever, dengue, malaria, swine flu, hepatitis, etc. He also has a YouTube channel where he conducts free live webinar. Then in line we have Mrs. Koing Samon Umbon. She is a Deputy Director of School Education, DDSE, Namsai, Arunachal Pradesh. Mrs. Koing took over the role since April 2020. She is an educationalist and a social activist. The journey of her profession began from a junior teacher in 1989, senior teacher in 2002, vice principal in 2008, and the principal in 2017. She got an opportunity to serve as assistant district education officer in 1995. She is part of VKV Tirab Vibhang Mahila Pramukh since 1997. She works for women development and awareness on women's rights. So yeah, that's the list of our expert panel who has joined us today. So very warm welcome. And in line also we have a quiz at the end of the session based on the webinar conducted and all the discussion done. So I request every student to pay due attention to the discussions and answer the quiz question in the chat box to grab a chance to win exciting gifts. So yeah, I request everyone to use chat box for communication in QA and quiz. So now without further delay, I would now like to hand over the mic to Dr. Komal Goswami, who will be talking about the vision and objective of the Birds and Beestock project. Yes, over to you, Dr. Komal.
Thank you so much, Jinu. Good morning and welcome to all. Thank you so much for I would really want to thank my esteemed guest speakers, team, my members, the schools that have joined us, and various other audiences that have. Hello, that have spared the time to be a part of this webinar. On World Hepatitis Day today on 28th of July, it is very imperative to talk about the subject that actually are a concern of our adolescent, of our children, that actually becomes huge and has huge impact in growing up years for our children and our adolescent. So our Durex the Birds and Beestalk program, this particular program is implemented by Plan India and is thought and under the thought leadership of RECIT. This particular project is being implemented in 6 northeastern states of India: Manipur, Mizoram, Arunachal, Nagaland, Sikkim, and Mizoram. The basic goal of this particular project is to inculcate healthy behaviors, is to focus upon overall healthier lives and healthier people, to provide life-saving critical information, to empower adolescents, to promote healthy behavior, to encourage community engagement, and to inculcate a feeling of inclusivity. So what we build upon in this particular project is that we give the right messages, we give the correct information to our adolescent, to children, to talk about the topics for particularly, which is very much necessary as on today. We are not celebrating, we are majorly spreading the awareness around the world hepatitis. Like how is it about our guest speakers, our esteemed guest speakers? I would like to thank Dr. Rajni, Dr. Tope, Ma'am Diana, and Dr. Banikanta to be a part of this webinar and to have this information going through the schools and children. Our objective, the pillar of this particular program is to build upon power, protection, and pleasure as well. Power to have the right decision with the children, protection to have the practices known, that is very much required to be a healthy living individual, as in growing up life skills, and pleasure to inculcate all fun arts and music culture, which we celebrate in our particular program, in our particular project across 6 northeastern states. We are working very closely with the children. We would want to provide children with the correct information. We have a very interesting curriculum that talks about the topic, which are such as consent, such as safety, such as relationship, etc. That is very much important, in life skills and this particular project especially target 10 to 19 years of age of children. So we have the audiences, we have mixed audiences over here. We have students, we have children, we have teachers, we have esteemed guests. So we would want to make this webinar as interactive as possible. I would urge again children to please put their question in the chat box. We also have a live quiz going on in the chat bot. We'll be asking few particular questions, like Jinu has already told. You can put your answers over there, just some basic answer that you can take away from this webinar, and let's make this webinar a platform to have two-way communication about interesting knowledge, which can be then which can be a foundation of having a safe space to talk about it. And as our theme says that we have to talk about the important topics, so let's talk about it. Thank you so much from my side. I am looking forward to hear our guest speakers and from our children. Thank you so much, Gino. Thank you.
Thank you, Dr. Komal, for the brief introduction of the project. Now, I'll be handing over the mic to Ma'am Diana, who will be talking about the status of hepatitis in Imphal East district and interventions taken by the state. Ma'am, over to you.
Thank you, Jinu. A big hi to Trishita the panel experts, and the participants of today's webinar to observe the World Hepatitis Day. Currently, as Deputy Commissioner, I'm also heading the District Health Society, Imphal East, Government of Manipur. Coming to the agenda, first of all, I would like to share why hepatitis is a cause of concern for our state, Manipur. Manipur is among the states with high number of people with living with HIV and AIDS. The rate of hepatitis infection might be high as it is one of the co-infectious disease of HIV and AIDS. Looking at the data provided by the State Health Society, National Health Mission Manipur, it has come to our notice that hepatitis prevalence is highest among the intensive drug users, accounting for more than 85% of the detected cases here in Manipur. The other categories include high people with showing high risk of sexual behavior, patients receiving blood transfusion, and persons with history of surgery, tattoo, occupational exposure to blood and other body fluids. So this chronic liver disease is one of the major cause of deaths among the population of our state Manipur, and hence the theme for this year's Hepatitis Day, hepatitis can't wait. So there is urgent need for effective prevention, diagnosis, and treatment. Now, coming to the status of the implementation of the only national health program on hepatitis, that is the National Viral Hepatitis Control Program in the state of Manipur. I would like the program was launched and rolled out in the state only on 20 July 2019 with the objective to eliminate hepatitis by 2030 as anticipated by the World Health Organization. On this particular day, 2 model treatment centers and state laboratory centers at RIMS and Jennings Hospital of the state were also operationalized. During the first year of its implementation, the viral hepatitis C treatment was made available in all districts of Manipur. Actually Manipur has got 16 districts as of now. The 7 were newly created, and district laboratory centers were also made functional at all districts since 13 January 2020. Even though treatment centers are not available in every district as of now, testing facility has been made available in all the districts of Manipur. Treatment centers would actually have been available in the newly districts of the state. However, due to the pandemic, the entire healthcare system has shifted towards combating the COVID pandemic. So there's some so that it was kept slow. Medicines and treatment are as of now have been provided to patients who are infected with hepatitis C. Today I'm also happy to share with you all in this platform that the treatment for hepatitis B shall be launched today at the state level, and the treatment shall be made available in phased manner under the same program starting today. Even this treatment, hepatitis B treatment, would actually have started long time back, but then because of the pandemic, again it was kept at stall. Now coming to the interventions taken up towards elimination of viral hepatitis in our state, screening for hepatitis B and C, they are being done in all the districts of Manipur, and viral lot testing is being conducted at RIMS and Jennings Hospital of the state. Injection of hepatitis B immunoglobulin is being made available for the newborn infants born to hepatitis B positive mothers. Since the start of the program, that is from July 2019 till March 2021, a total of more than 32,000 hepatitis B patients have been screened and 477 have been found positive. Likewise, 31,800 hepatitis C patients have been screened, and out of which 1,519 were found positive, out of which 1,225 patients, they were put on treatment. And the good news is so far 861 patients recovered. So more persons might have been cured had this pandemic not disrupted the normal functioning. As a way ahead for successful elimination of this disease, opening more treatment centers is very crucial so that free treatment be available in nook and corner of the state. Another aspect is raising awareness and advocacy to improve access to the hepatitis screening, diagnosis, and treatment in the state. And another is the vaccination and timely initiation of antiviral treatment, which is very essential to control the disease. I would also like to highlight some issues which is faced and by the program due to the COVID pandemic. Enrolling new patients under the program has been affected because of the lack of viral load testing facility, as it was fully engaged for the COVID-19 testing. So, but then considering the severity of this disease, the state has set up the private health diagnostic center and has resumed the program. And those patients who had started receiving treatment before the pandemic, they're actually receiving the treatment without disturbance. Even during this curfew period, lockdown period, the health department has made necessary arrangement for dispersal of medicines for those who are under treatment in the respective district hospitals and through dedicated NGOs. In all these efforts, the role of NGOs, they play a very vital role here. Some NGOs I would like to mention here, such as the Community Network for Empowerment, Medicine Science Frontiers, YRG Care, etc. They have actually helped the state in successful implementation of the program. So to conclude, during the COVID pandemic, these NGOs, they have been trying their best in linking the hepatitis C patients from far-flung remote places of the district and those in dire need of treatment with the state health department. So such support and coordination extended from the dedicated NGOs and CSOs, it is one of the major means which is going to make us achieve the target. So in all these efforts, all the stakeholders, they need to come together. We need to work together on war footing so that we'll be able to eliminate this dreaded disease by 2030. With these few points, I would like to cut short my session, wishing the Birds and Bees Talk project a grand success in reaching out to the very last individual of all the northeastern states. Thank you so much.
Thank you so much, ma'am. That was a very informative discussion about how, about the administration of how to control the spread of the whole virus. Thank you so much for the informative session. Now we have a wonderful performance by Mr. Chung Nihao Daungel, who is our district coordinator for the project in Manipur state and also a very talented singer. The song performed by Chung is the theme song of the Birds and Beestalk, which was launched in the month of June, which was also a Pride month. So there was no better time to launch the song and arm the teenagers with information that supports the core principles of sexual awareness, protection, inclusivity, and consent. I'm very excited about his performance. Over to you, Chung. Hello, Chung. Okay, okay. So I think Chung is facing some technical difficulty. So we'll move to the next session and maybe Chung can give us his performance in some time. So now we have Dr. Rajni Wadhwa, who is the Director for Implementation of Projects in Plan International, who will be discussing about the importance and significance of the today's theme, which is Hep Can't Wait, Hepatitis Can't Wait. So Rajni ma'am, over to you, please.
Thank you. So good morning, everyone. I'm glad to be a part of this webinar. It is a pleasure to talk today along with all the distinguished panelists. Plan India has been working for more than 2 decades to improve sexual and reproductive health services and well-being for all children, adolescent girls, young women and men. To mark World Hepatitis Day, through this webinar session, we aim to inform adolescents, young people and teachers by promoting knowledge on awareness and prevention strategies on hepatitis-related illnesses. Before I start, let me narrate a heart-shattering experience I had when I was in college. My cousin, a young female of 28 years, kept sick all the time. During the advanced stage of disease, the doctor informed us that her liver has been severely damaged due to hepatitis infection. Even liver transplant was not an option then, and we lost her. At that time, none of us knew what hepatitis is all about, and that was when I started reading about it. World Hepatitis Day is a great opportunity for us to raise awareness of the importance of knowing your hepatitis status and to spread the word about treatment. For this webinar, I wanted to focus on information on what is hepatitis and why is it important to talk about hepatitis. I will try to decode the importance and significance of today's theme, Hep Can't Wait. So coming to the ABC of hepatitis, it is an inflammation of the liver most commonly caused by a viral infection. There are 5 main hepatitis virus types, A, B, C, D, and E. Hepatitis A and E cause acute short-term diseases. Type E can particularly affect the pregnant women adversely. Type B, C, and D can most likely be ongoing and dangerous. Chronic hepatitis B and C are life-threatening infectious diseases that can cause serious liver damage, cirrhosis, liver cancer, leading to premature deaths. Hepatitis B and C are silent epidemics hitting children and marginalized populations. It is also common in people who inject drugs, prisoners, those who have unsafe sexual practices, migrants, and people living with HIV/AIDS. Globally, more than 300 million people are living with the hepatitis B or C virus, and India is hyperendemic for hepatitis A. Now visualize this. By the time I finish this sentence, someone would have lost their life to hepatitis. It could be your parent, your partner, your friend, or you. But it doesn't have to be this way. There is a cure for hepatitis C. There is a vaccine and effective treatment for hepatitis B. 9 out of 10 people with hepatitis don't know they have it. Many young people have not heard about hepatitis, though they may know more about HIV or COVID now. Also, there is a lot of stigma around the infection. Just a few days back, I was listening to a young man's interview on how he faced stigma and discrimination and was disqualified from a job because he tested positive for hepatitis. It is so unfortunate. Another young boy from university was talking about how like-minded students who were passionate about hepatitis outreach and spreading awareness came up with quiz boards, TikTok influencers and videos to expand the outreach and keep the information flowing and accessible using digital means, especially during this pandemic where everything was closed down. I do think youth can really make a tangible difference through their enthusiasm and sometimes better suited as they have different skill sets and creative solutions. It is so important to harness the energy and passion of young people to halt this epidemic. What is required is access to information, access to testing, access to vaccination, and access to better treatment. Hepatitis can't wait. But to stop it, we should not wait to act. With a person dying every 30 seconds from hepatitis-related illness, I can't wait. People living with hepatitis and unaware of it can't wait for testing. People living with hepatitis can't wait for life-saving treatments. Pregnant mothers can't wait for hepatitis screening and treatment. Newborn babies can't wait for birth dose vaccination. People affected by hepatitis can't wait to end stigma and discrimination. Organizations like ours can't wait for greater investments. Policy makers can't wait and must act now to make hepatitis elimination a reality. The youth can't wait. India can't wait. We heard the status and interventions from Imphal. We will further hear from Arunachal Pradesh and gain some clinical understanding on hepatitis in the subsequent discussions. With this, I will stop and pass the microphone back to the moderator. Thank you.
Thank you so much, ma'am. Thank you so much for sharing that information on the theme and the importance of the topic today. Hepatitis can't wait. And now I would like to, hand over the mic to Chung. I hope his technical issue is sorted. Chung, can you please confirm? Chung, hello. Okay, so I think we still have that problem. So in the meanwhile, I would request Dr. Tope Yamcha, who will be discussing about what is hepatitis and what is a national viral hepatitis control program and its implementation in Arunachal Pradesh. So Dr. Tope, I'll hand over the mic to you, please, sir. Hello, Dr. Tope. Hello. Okay. I think there is a technical difficulties on Dr. Tope's side as well. So I would like to move on to Dr. Banikanta. Dr. Banikanta will share about clinical understanding and risk in children and youth and its prevention. Dr. Banikanta, over to you, please.
Hello, am I audible?
Yes, hi, Dr. Banikanta.
Good
morning.
Hi, good morning. It's a great honor and a pleasure to be part of this webinar and a program among such distinguished guests and participants on this occasion of World Hepatitis Day. So, let me just briefly talk about this Hepatitis Day. Well, this day is observed to honor Dr. Baruch Bloomberg on his birthday, that is 28th July. He was the person who discovered hepatitis B and even developed hepatitis B vaccine. And as we know that hepatitis B has a very serious consequence to our health, and he helped us saving so many lives. As per the WHO, World Health Organization, every 30 seconds, one person dies of hepatitis or its related illness. And about 1.1 million people dies every year due to hepatitis. And there are about 3 million new infections that occur every year in the world in the world due to some kind of hepatitis infection. So now coming to the clinical aspects of hepatitis and its importance in our public health. So basically, hepatitis is the systemic infection which causes the inflammation of the liver, and it can have a very serious consequences on our health. Normally, the hepatitis can be due to 5 types of viruses. Deaths are to be like hepatitis A, hepatitis B, hepatitis C, hepatitis D, and hepatitis E virus, which can cause hepatitis in our body. So in these 5 types of viruses, normally as per the transmission and as per transmission, we can subdivide them into like hepatitis A and hepatitis E that can be transmitted by the fecal oral route, means like through some contaminated food or contaminated water. And this hepatitis A and hepatitis E can cause a very acute hepatitis, that is acute onset, And very rarely it can go to chronic, but it's mostly causes acute in the recent infection. So let me just a little bit go for the symptoms, the common symptoms and the signs that this type of hepatitis can have. A person who is infected with hepatitis may not know in the beginning. It has some incubation period in which the virus multiplies in our body once it enters our body. So maybe after, let's say, after a few weeks, like 3 or 4 weeks, a person may start having symptoms like a fever, body ache, weakness, and a feeling of or nausea or vomiting or pain abdomen. And finally, the person may start having jaundice, that is the yellowish discoloration of skin and other parts of the body, or even urine and stool. So these are some common symptoms of the hepatitis A and hepatitis E, which are mostly transmitted fecal-oral route. So most of the time, a person who has this infection spontaneously recovers. But in some cases, in few cases, the person may have acute liver failure. And this is a very serious condition in which the person may start having altered sensorium and bleeding tendencies. And a liver transplant may also be required. So next, I want to categorize it into the hepatitis B, C, and D as far as transmission. Well, hepatitis B, C, and D mostly are transmitted through parenteral, through our body fluids and blood, like through blood transfusion, sexual intercourse, unsafe or sharing of injections, drug use, etc. So normally hepatitis B, C, and D cause chronic infection that people most of the time don't even know that they have the hepatitis. They accidentally find out, or maybe after some testing, or maybe in some cases it can cause some acute infections, like if the person may have like a fever or body ache, or like that, especially in the case of hepatitis B. But most of the time it can cause chronic infection, like it has a persistent infection inside the body. And this is very dangerous because when this hepatitis B or C remains persistent in our body, which is called a chronic infection, then it can cause the liver cirrhosis and liver cancer, which is very dangerous and which has a very high mortality among the patients. So these are brief discussion about the various types of the hepatitis. Now coming to the part of the treatment. Well, hepatitis A and E are mostly given symptomatic treatment and support in hospitals for the patients. Whereas hepatitis B and C, we have antiviral drugs to treat this hepatitis B and C. Whereas hepatitis D occurs mostly concomitantly with hepatitis B. So now talking about the children, hepatitis A, hepatitis B, and even C are commonly found in the children and commonly found in the children. So now talking about the prevention. So what we can do is that prevention of this hepatitis A and E is mostly that the hygienic food and water. That what you eat, what you drink should be hygienic. The water should be clean or properly boiled to prevent the infection. And about the hepatitis C, D, hepatitis B, C, and D, that safe blood transfusion, safe sexual practice like use of condoms, or the avoid having sexual intercourse with multiple partners, then the use of disposable single-use syringes for the in hospitals and clinics. Then these are the few. Then to prevent the transmission from the mother to child is one of the very important steps in prevention of hepatitis, because hepatitis can be transmitted from mother to child during birth or during pregnancy. So there are some interventions which you can do. The first of all is that some medicines can be given to the pregnant mother, mostly in the third trimester or at the end of the pregnancy. And vaccination should be done for all the newborns. So it's all the newborns are typically vaccinated on the same day within 24 hours after within the delivery, within 24 hours after delivery. And if the baby is born to the mother who is infected with some kind of hepatitis, then there are immunoglobulins which can be given to the newborn babies, because this hepatitis B or the C, which are mostly transmitted by through this vertical transmission that we call from the mother to child, can cause the chronic infection, and it can be very dangerous for the baby in long run. So these are the few steps or the few preventive measures which we can do for the prevention of the hepatitis. Well, as some speakers have already mentioned, that there is lack of awareness about the hepatitis among the public. So it's very important that the various organizations, government bodies, through such programs, webinars, and spread awareness about hepatitis, so that at least the people take vaccinations, people give vaccinations of their newborns and babies in time, so that people know about the preventive measures, that especially the young children and those adolescents, they know about the safe sex, about the drug abuse and its consequences. So the awareness programs are very crucial in because of in prevention of the hepatitis. And in India, as the population, we have a very huge population. So the number of the hepatitis are also very huge. And we even don't know the exact number, because the people are not getting tested. So we need to promote the testing, we need to promote vaccination, and we need to launch programs and webinars which help in spreading the awareness about hepatitis. So I really appreciate the initiative taken by the Plan India about this hepatitis on the occasion of the World Hepatitis Day. So these are a few clinical aspects and about hepatitis on the World Hepatitis Day. Thank you.
Thank you so much, Dr. Banikanta. Now we have a better understanding of the clinical aspect of it and how to reduce the risk and prevent it in children and youth. Thank you so much for this information today. Now I think we have Dr. Tope on board, who will be discussing about what is hepatitis and National Viral Hepatitis Control Program and its implementation in Arunachal Pradesh. So Dr. Tope, passing the mic to you, sir.
Yes. Good morning, everybody.
Good morning, sir.
Am I audible now?
Yes, sir, you're audible.
Yeah. Thanks for the introduction, and thanks to Plan India and the talk that's giving me to talk about hepatitis. Earlier, I already gone through and all about this. So I will just repeat few points and the important point, some other points to set back.
I think sorry to interrupt, sir. I think
hepatitis is a hello.
Hello. Yes, sir. You're audible now. There was, voice break.
Yeah. Hepatitis is a community disease now has become a disease of the community, and it's a challenge for the community to overcome this disease from spreading more in the community. The hepatitis B, why are we talking it? But it affected many citizens in our country, and our state is not an exceptional as well. So it is said that annually more than 5.5 million they are hepatitis infected. Hepatitis B shares lion's share. It is about 70% of them. So it has put more importance in all the hepatitis, controlling all the for the hepatitis B, which is more significantly affecting population. So now the government has introduced the hepatitis control program in the country, and in our state it was launched just a few years back only. So what we are doing here in the state and in my district is, first of all, we are identifying the vulnerable groups. The first, the healthcare workers, those are being vaccinated with vaccine in the first phase, and all our health workers are vaccinated. So we have already completed our vaccination of health workers in our districts, and those group in the most vulnerable. And as said, this discussion into the physiology and all this, because previous speakers have already spoken about it. I am well with the how it can be controlled and what is ALS. And this the consumption of alcohols is also one of the factors earlier which predisposed to the infections of the hepatitis, like hepatitis means inflammation of the liver. Now there are multiple factors like virus, as we are discussing today, and autoimmune disease, some of us have already been discussed. How it is transmitted from the it is become airborne and food through the food and also. And there is another factor is the on-the-counter medications. I would like to make an emphasis here to the youth that our youth or the populations, without going to the doctors or without going to the hospital, they just go to the pharmacy and take medicines. These medicines can be harmful for also liver diseases. These are some factors that we should look into and give awareness to the people. And another factor is becoming more heavier by weight. That means obesity. Obesity, especially during this COVID pandemic, many of our people and the youth, they are working from home, and schools are from actually they are online audit. So the way of the that also predisposed to the liver problem. This may also predispose to the diabetes, and this can lead to the what's called not by cause, but it can predispose to the cause of the hepatitis also. So these are few points I would like to add here. And in our district, this consumption of opium has been traditionally accepted from the olden days, especially in the occasions of marriage and festivals, etc. Now it has become an abuse, and that is another cause of how this hepatitis can be spread from one person to another. Like earlier speaker has also said that this transmission can be through blood, through semen, through body fluids, and doing birthing also, and use of infected blood. And these the drug abuse people, especially the young people who are indulging in these activities, they can share. They often, it's been seen that they often share the needles, and this can also transmit the hepatitis, especially the virus, hepatitis virus. Those are very common, especially in our area. That is B, hepatitis B, which is, and this hepatitis B, as I've said, is more dreaded than any other these hepatitis B groups, because it spreads in a very high degree. And as for hepatitis C, I want to add one more information here. That it is usually very subdued virus, this hepatitis C, because it acts without provoking any what's called visible symptoms. So one may not feel that he is suffering, but when the symptoms appear, then it will be too late for this. And it accounts, this hepatitis C also accounts for the death than any other hepatitis in this we are discussing today. So now going to the prevention parts, as I've been launched. The second, I would emphasize on cleaning of the environment, like cleaning of the water sources and the drinking of what's called water, boiled water. This is very feasible. And another is food items that should be washed properly and should be hygienic. The other preventive parts will be taken care of by this vaccination. And I am looking into these vaccinations in my masters. And what we emphasize on vaccination, as Dr. Banikanta has also said, earlier the better. At birth, we give hepatitis B within 24 hours of the delivery. That is why the institutional delivery, we should encourage our pregnant women and the community people to take avail the facilities in the health centers to deliver their in the health centers, so that the vaccination can be done within 24 hours of delivery. So even if one has by any chance delivered at home, they should be encouraged to take the vaccine 24 hours. And there is another schedule for the infants that after this we give 3 doses of this hepatitis B vaccination, which is available in the other forms like pentavalent vaccines, where there is a combination of 5 vaccines, and one of them is this hepatitis B. So we give it in the 6 months, 6 weeks, 10 weeks, and 14 weeks at a gap of 28 days. So these are being provided in the healthcare facilities, where it is everything free of cost. Only thing the patients come to the center or health centers to avail this, and we can, as responsible citizens, we should spread this news in the far corners and interiors of the villages that this is available. And now the people are more or less aware of this, and they are availing these answers. This can be done. And for adults, there is also vaccination for adults. And then adults are also given, but at any age. But it is preferred that youths and adolescent groups, they take the vaccines earlier. There are 3 doses also at the 0 day, then after 1 or 2 months, and then 4 to 6 months from the first dose. But one has to remember that this gap should be at least 1 month or 28 days in between 2 vaccines. So these are the facilities available here, and we are also providing these services to the needy people in our district and the state as a whole. So, and coming back to this birds and bees can talk, I have an opportunity to work with these organizations here for the last couple of months actually. Otherwise, and then I extend my thanks to once again to the Plan India that we recently launched in our district, and the persons involving here. Jinu, I can see I have heard of you, but not met you before, and Kamal and all others who are here in this organization. Very, very important and very lively sessions. So hope to see you or to participate in such sessions in the coming days. Thank you, sir. Thank you, everybody.
Thank you so much, sir, for explaining us about NVHCP and also your participation with us throughout the project. I'm looking forward to meet you as very soon. So thank you so much, sir. And then now I would request Mrs. Koing Samon, who is DDSE for Namsai, Arunachal Pradesh, to talk about hepatitis interventions in school and awareness programs for students. So, ma'am, over to you, please. Hello.
Good morning to all of you.
Good morning.
Today it is a program of hepatitis B. So hepatitis is a disease which may affect you and affect everyone. So that's why prevention is better than cure, as the saying goes. So all the student participants, you have listen about the program, and I hope you have learned many things which will be fruitful in your life. तो मैं हिंदी में कहना चाहूंगी कि हिंदी कहने से होगा ना क्या?
होगा मैम, डेफिनेटली होगा.
So actually I am not prepared about it also, but then every disease is dangerous for life, so we must always adhere to the do's and don'ts of every disease. In Arunachal, we are having rain frequently, so due to that also many diseases pop up in our area. So we must take care of the hygiene of our surroundings, of our schools, and we must follow the protocols given by the government. According to Dr. Tope Yomcha sir, even the pregnant women should be taken care of. Otherwise, they may have hepatitis. And many newborn cells in today's life have a jaundice when they are born. At that time also treatment is given in the medical. So hepatitis actually it affects the lungs and the liver, etc. So we should be very careful about it. And whatever advice given by our doctors, our health workers, ASHAs in the villages should be adhered to, that should be followed by everyone. Otherwise, we may get the disease. So for mosquito also, we must have a net. Mosquito net should be used. Otherwise, we'll get malaria. Likewise, waterborne diseases are there. So we must take care of the water also. We should take the filtered water. Otherwise, it may cause many kind of diseases. So, disease will come anytime. We cannot say we are free from diseases. It may come at any time. So, we should be always careful, and we should follow all the measures to stay away from such diseases. तो मैं यही कहना चाहूंगी कि मैं तो ऐसे आई एम नॉट ए मेडिकल एक्सपर्ट, तो हम लोग खाली सजेशन दे सकता है कि आप जो भी हमें कहा गया है, या फिर आज का जमाना में हम लोग यूट्यूब में देख सकते हैं, गूगल में देख सकते हैं, कहीं भी मोबाइल बिकम्स ए स्टोर हाउस ऑफ नॉलेज, तो हम वहाँ से भी बहुत कुछ सीख सकते हैं। इसलिए हम समय रहते हर चीज का प्लान करना चाहिए। इवन अभी जो कोविड चल रहा है, कोविड में भी प्रिवेंशन को ज्यादा इम्पोर्टेंस दिया गया है, जिसका वजह से बहुत लोग इस बीमारी से बचा है। इसी तरह से हेपेटाइटिस को भी हम लोग उसको मालूम होना है। जब वो उसका कॉज मालूम होगा तो हम उससे बचने से हमारा बीमार नहीं होगा। फिर खान पान जो है हमारा विटामिन है, वो सबको हम लोग लेना है, क्योंकि हमारा our food should be become a medicine, so we should be careful while taking the foods. We must have a balanced food. In Arunachal, we are having organic vegetables from the jungles that is totally organic. So we must take all those herbs जो हमारा एरिया में मिलता है। हम वो बाजार से पिज्जा बर्गर खरीद के खाने से अच्छा है कि हम अपना ही घर का जो सब्जी है, बॉयल सब्जी है, उसको भी हम लोग जैसे 5 स्टार होटल में सुंदर से बना के देता है, वैसे हम लोग भी अपना प्लेट को सजा के टेस्टी करके खा सकता है। तो लेकिन हम क्या सोचते हैं, गांव में तो जैसे तैसे हो जाएगा, होटल में तो चमकदार वाला खाना है, इसका वजह से भी हम लोग का बीमार ज्यादा होता है। तो हम लोग फास्ट फूड वगैरह से दूर रहना है, अपना घर में जितना सकता है अपना जो माँ पिताजी बना के देता है वो खाना है। और अगर हॉस्टल में रहता है भी तो वहाँ में भी आप लोग अपना से बना के खाना है, तो अपना हेल्थ जो मेंटेन होगा, तो हमारा जो फूड है वही मेडिसिन होना है, ये तरीका से हम लोग सोचना है। और जो भी जैसे मल्टीविटामिन वगैरह कुछ मिलता है, जैसे पपीता खाने से उसमें 4 विटामिन मिलता है, तो वो जो उसका बाद में पम्पकिन वगैरह जो भी सब्जी है उसका जो विशेषता है उसको मालूम हो के हम लोग खाना है, तो हम ऐसे जितना भी बीमार है उससे हम लोग दूर रहेगा। मैं इतना ही कहना चाहता हूँ, क्योंकि मैं इतना ज़्यादा एक्सपर्ट तो नहीं हूँ मेडिकल लाइन में, फिर भी मैं सबसे रिक्वेस्ट है कि जो भी हमने सुना है उसको हम ध्यान देना है और अपना से भी सीखने का कोशिश करना है। So with these few words, I conclude. Thank you.
Thank you so much, ma'am, for discussing about how to intervene, how to intervene Hep spread in schools and students. So now we have a lot of questions in our chat box, and I would request Trishita, who is our PMU lead for the project, to take up these questions and take over the Q&A session for the whole event. So Trishita, over to you, please.
Good morning, everyone. Hello. I hope all of you are having a great time, because as for me, I really got to know many new things on hepatitis. It's a topic which is very rarely talked about, and most of us are unaware about it. So because of that, we can see that there are so many queries coming from all over different states, from students, from teachers. So we will be taking a few of the questions right now to our specific guest that these questions are for. So I'll start with the first question. Yes, there's a question which I would ask Rajni ma'am to please respond. So one of the student they have asked, can COVID-19 push patients with hepatitis to more severity, and if the over the counter drugs which are available can be taken by hepatitis to patients. Ma'am, if you could please
Yeah,
answer it.
sure. See, like any other comorbidities, so hepatitis is this medical condition. If there is an underlying medical condition, the person will have an increased risk for severe COVID infection. So yes, also not only the severe risk, but also because of the other effects of COVID, lockdowns, etc., they may not be able to easily access the treatment, or if they require medical attention. So yes, definitely it will have an adverse effect. The severity of the disease would be more. As far as over-the-counter drugs are concerned, these are antiviral drugs and these are on prescription medicines. So it is important to follow your doctor's advice and take the medicines accordingly, not self-medicate here. Thanks.
Thank you, ma'am. That was very helpful. Then we will move to Banikanta, sir. If Mr. Banikanta can, Dr. Banikanta can answer the next question. So another question is if we have like hepatitis, can we donate blood to other patients, or organs, can it be donated to other patients? And like the main, if you can give us the quick like precautions that can be maintained by all of us to prevent ourselves from the infections.
Okay, as I mentioned earlier, normally screening of hepatitis is done before any kind of blood donation. So if you have asked me about blood donation, then I think you cannot donate the blood if you are hepatitis positive, or if you are having hepatitis actively. If you have already been cured, there's a different case. But if you are having hepatitis or having these infections in your body, then you cannot donate the blood. And regarding preventive measures, as I mentioned earlier, these are the few preventive measures which can be divided as for the type of hepatitis virus. First of all, what you need to do is we have to have a hygienic food and drinking water, because hepatitis A and E can be spread from this fecal oral route, that is mostly from contaminated food and water. And secondly, about hepatitis B, C, and D, it can be transmitted through blood transfusion, through the unsafe sex, through mother to child transmission during pregnancy or during delivery, mostly during delivery, and drug abuse, then sharing of contaminated syringes. All these can lead to spread of hepatitis B, C, and D. So our preventive measures would be to save sex practices, then safe blood transfusion. Like we have to screen all type of hepatitis, like hepatitis B and C before transfusion. Then safe use use of disposable syringes or single-use syringes. So these are the few things that we need to do as a preventive measures. And at the same time, if a pregnant woman is hepatitis B or C positive, and then this thing particular medicines can be given, especially in the third trimester of pregnancy. And after the baby is born, then the baby can be given some immunoglobulins and the vaccines to prevent or to prevent the infection. And there is a huge importance of the vaccination, especially the hepatitis B and hepatitis A, which can be given to prevent the respective hepatitis. So hepatitis B vaccine is given right after the baby is born, especially within the 24 hours after delivery. Whereas hepatitis A vaccine can be given after the age of 1 year. So these are the few preventive measures which we can do against or to prevent hepatitis infections. I hope I answered the question.
Yes, thank you, sir. That was very informative. And another very interesting question we have from Nagaland. So I would ask Dr. Tope, sir, if you can please respond to that. So the question goes as, are there awareness campaign for the hepatitis control by the health department? Because this topic is very new and unknown to the people in Nagaland. I think it's not just Nagaland, even in rest of the Northeast, the whole topic is very less aware. We are very not aware of the program. So, and the programs associated with hepatitis. So Dr. Topes, sir, if you can please respond to that, if what kind of awareness programs we have towards hepatitis from the government side.
Thank you for the question. Awareness program as government as today is also one of the awareness programs that we are having, observing World Hepatitis Day. On all health facilities, in all health facilities, and there is information shared to the whoever attends the hospital or the hospital premises. So there is an awareness program everywhere in the health today. The other is through the village health and nutrition committee in the village level, where ASAs, the functionaries and the PRI members and all the village elders, NGOs and youths are the functionaries and their part. There every month these not only this hepatitis B communities being talked about, or and being informations are being shared regularly, not only as I should say, this many other programs are through these flags. So these are being in through the government, and another is testing of especially screening of all the moment those are being registered for antenatal cares are being tested mandatorily. Screen mandatorily, and through this also the information is shared to the community level that this should there is this called hepatitis B, and it is very prevalent, so one has to get tested, or especially the pregnant women. And these programs are being carried out by the government and through the state government and through the local activities going on, and time to time we are especially in the village level activities are going on, screening and this active awareness programs. Another emphasis I like to mention here is that some of you might have also come across that there are a few people engaging vaccines of these hepatitis, especially the hepatitis B vaccination campaign going on in the rural areas and some of the areas, far-flung areas. So I would like to make a caution here that these beneficiaries they be screened actually, so that to rule out the presence or the that is be in the body. So another is screening. Then how far these vaccines are viable? Like are they maintaining the cold chain process? Government of India or the government emphasized on are they being maintained? These are two points I would like to inform to the participants that when there is a program, please look into this. So this can be another information that I want to share.
Thank you, sir. That was really informative, and we thank you so much for giving us this time. So, to Koing, ma'am, we have another question. Ma'am, if you can respond to this one last query, which is why do you think it is important to talk about these such diseases to children and students in the adolescent age?
Are you addressing this question to me?
Uh, Actually, awareness is very much necessary. If we know the disease, then we can take care of. That is why such kind of diseases should be exposed to our students to avoid them, so that in future they may not fall into such diseases.
Okay. Thank you, ma'am. We have another interesting question, which
May I implement here one?
yes, sure, please, sir.
We have adolescent health and adolescent program under RK. Then within under this program, every school of the government and government private schools also, that these informations, be it on COVID, be it on this hepatitis B, be it on HIV or any be on vaccination, these are also is the part of these information that are being in health sector. Then information on HSB as well, and it is being done as well actually in schools and all other non preschool students.
Thank you, sir. That is really great to know that the NHM and the education department have many programs and awareness and towards children to make us all aware of these very important issues and diseases that we can keep ourselves safe in future. Thank you so much. I will hand over the mic to Jinu now. Thank you.
Thank you so much, Trishita, for asking these interesting questions, and thank you to all our guest speakers who have given very informative answers. I hope the event was very informative session for all of you, just like it was for me. I gained a lot of information today regarding hepatitis, and for sharing this knowledge with us and giving us with the. Yeah, yes, thank you so much. So yeah, so I would like to thank our expert panel who joined us today to close this wonderful and informative session. I would like to invite Dr. Jyotsna, who has joined us today. So Dr. Jyotsna is a public health professional and have extensively worked on projects to tackle difficult problems and working with diverse stakeholders through innovative approaches to bring changes to our society. Dr. Jyotsna is Assistant Manager for BSI, Banega Swasth India program by Ricket, who is also our donor for the Birds and Beestock project. So, yeah, over to you, Dr. Jyotsna.
Thank you, Gino, and congratulations. I think it's been a very informative event, and it's great to see the participation that we've got from the audience today. So, thank you for the opportunity. A few words to conclude this webinar. So the Birds and Bees Talk program was launched with the objective of enabling adolescents and youth to develop the right life skills and equip them with the right knowledge to be able to grow up into healthy, productive adults. And a concept of self-care that had come up it was proposed by the WHO and organizations like the White Ribbon Alliance quite some time before, became extremely important during the COVID pandemic, because self-care is an approach that empowers people to look after their own health in the best way possible. And this encompasses hygiene, nutrition, lifestyle, habits, and beliefs. And hepatitis as a disease is something that is extremely preventable. The variants can be preventable either through vaccines or with the right treatment. So all the topics that we've discussed today and whatever the experts have educated us with today, all of these point to very simple interventions that can be taken at an individual level as well, in terms of protecting ourselves through vaccines or through the right information, so that we lead healthy lifestyles, healthy diet, we ensure that we maintain hygiene, so that we don't get infected with the variants that are transmitted through food and water, through unsafe food and water. So in a nutshell, I think the Birds and Bees talk is achieving its objective of equipping adolescents with the right information, and webinars like this on extremely relevant topics can go a long way in ensuring that we reach more and more adolescents at the right age before, and this is a time where they are extremely vulnerable and they are curious. So it's a more paramount that we engage stakeholders like this to be able to talk about important topics that probably we wouldn't have encountered. Even on a personal level, I myself only came to know about hepatitis because my parents were doctors. And it was when I got vaccinated at the age of 18 that I understood that there is a viral disease and this is something that can be prevented easily. But even now, I think the awareness levels are extremely low in our country. So congratulations again, and looking forward to many more of these webinars in the future. Thank you so much.
Thank you so much, Dr. Jyotsna. Some students showed keen interest in the topic and listened very carefully and came up with some interesting questions, which was happily taken up by our expert panel today. So thank you so much for answering those questions. So now, to show our appreciation for your attentive presence, we are very happy to reward you with Amazon gift vouchers. So the vouchers will be available. So thank you, students, for your active participation. And to honor the presence of all our esteemed guest speakers and participation of school today, we would be also sharing certificates of appreciation for your participation, which will be again shared with you within 24 to 48 hours. So now, while closing the event, I would like to thank you for making this event a huge success with your participation, and all the guest speakers. Thank you so much for taking out your time from your busy schedule to share the knowledge about hepatitis and making our youth aware how to prevent, how to take care, to avoid from this disease. And yeah, thank you for behalf of Ricket, and thank you so much for sharing the knowledge. Have a good day, everyone. Thank you.
Thank you.
Thank you.
Thank you so much. Thank you everyone.
Thank you.
Thank you so much, sir. Thank you, everyone.
Thank you to our guest speakers.
Thank you all.
Thank you, everyone.
Thank you.